What is Quviviq used for? Pharmacology education for PMHNPs. In this lesson, we will cover the mechanism of action, clinical indications, critical safety warnings, and the dosing guidelines for Quviviq. Hello everyone and welcome back. My name is Ben Osevwe, DNP-PMHNP. Today we are talking about daridorexant, also known by the brand name Quviviq. Before we get started, remember that this education is for learning purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Please do not start, stop, or change any medication without speaking with your prescriber. Alright, let's talk about Quviviq. And don't worry, we are going to keep this simple. We are not here to turn sleep science, orexin receptors, bedtime routines, and controlled substance warnings into a sleep medicine obstacle course. We are here to understand the medication in a way that patients, families, students, and providers can actually use. No unnecessary big words, no confusing sleep gymnastics, just clear education with a little fun. What is Quviviq? Quviviq is the brand name for daridorexant. It is a prescription medication used to treat insomnia in adults. Insomnia means difficulty falling asleep, difficulty staying asleep or waking up too early, and not being able to return to sleep. Quviviq belongs to a class of medications called dual orexin receptor antagonists. That is a big phrase, so let's break it down. Orexin is a brain chemical involved in wakefulness. It helps keep the brain awake, alert, and active. Quviviq blocks orexin receptors. In simple terms, Quviviq helps quiet the brain's wakefulness system so sleep can happen more naturally. Quviviq is not a benzodiazepine. It is not Xanax. It is not Ativan. It is not Ambien. It is not a Z-drug. It is not melatonin. It does not work by pushing the brain down through GABA like benzodiazepines or Z-drugs. Instead, it works by blocking the stay awake signal. Think of the brain at night like a security guard who refuses to clock out. The body says, "It is bedtime." The brain says, "No, let's review every awkward moment from 2009. Quviviq comes in and says, "Thank you for your service, wakefulness system. Please go home now." It does not force sleep like a hammer. It helps reduce the signal that keeps the brain awake. What is Quviviq used for? Quviviq is used for adults with insomnia. It may help with difficulty falling asleep, difficulty staying asleep, waking up during the night, poor sleep quality, sleep problems that affect daytime functioning, and feeling tired because sleep is not restorative. It is used when insomnia is causing distress or impairment, and when a provider decides medication is appropriate. A patient may say, "I am tired, but my brain will not shut off. I wake up at 2 a.m. and cannot go back to sleep. I spend hours in bed waiting for sleep. I sleep, but I do not feel restored. I am exhausted during the day because my nights are terrible." Quviviq may be considered in those situations. A simple teaching line is, Quviviq is a sleep medication for adults with insomnia. It helps reduce wakefulness signaling so the brain can fall asleep and stay asleep more easily. Let's go a little deeper, but still keep it simple. The brain has systems that help you stay awake and systems that help you sleep. One of the wake-promoting systems uses a chemical called orexin. Orexin helps keep the brain alert. During the day, orexin is helpful, but at night, if the wake system stays too active, sleep becomes difficult. Quviviq blocks two orexin receptors, OX1 receptors and OX2 receptors. That is why it is called a dual orexin receptor antagonist. Dual means it works on both receptor types. Antagonist means it blocks the receptor. In simple terms, Quviviq blocks the brain's wakefulness signal so sleep can come more easily. Think of orexin like the brain's daytime security alarm. During the day, that alarm is useful. But at night, if the alarm keeps yelling, "Stay awake, Think about bills, remember that email, replay that conversation. Then sleep suffers. Quviviq helps turn down that alarm. It does not knock the brain unconscious. It helps remove the stay awake message. That is why Quviviq is different from medications that mainly sedate the brain. It is more like taking the foot off the wakefulness gas pedal. Quviviq is a Schedule 4 controlled substance in the United States. That means it has accepted medical use, but there is still potential for misuse or dependence. Patients should take it exactly as prescribed. Do not share it. Do not sell it. Do not take extra doses. Do not combine it with alcohol. Do not use it as a casual sleep experiment. This is not a "my cousin cannot sleep, so I gave them one medication." That is not helping. That is dangerous. A simple teaching line is, Quviviq is a controlled medication. Take it only as prescribed, store it safely, and never share it. Starting dose, titration, and maximum daily dose. Quviviq is usually taken once nightly. The recommended dose is commonly 25 milligrams to 50 milligrams taken by mouth within 30 minutes of bedtime. Patients should only take it when they can stay in bed for at least 7 hours before needing to be active again. Simple dosing summary. Starting dose, commonly 25 milligrams once nightly. Dose range, 25 milligrams to 50 milligrams once nightly. Maximum daily dose, 50 milligrams once nightly. Timing. Take within 30 minutes of bedtime. Sleep window. Only take if able to stay in bed for at least 7 hours. The dose may need adjustment based on liver function, drug interactions, age, sedation, and response. Some patients may need the lower dose. More is not always better. The goal is better sleep with safe morning function. Quviviq is taken once at night, close to bedtime. Take it within 30 minutes of going to bed. Only take it if you can stay in bed for at least 7 hours. Do not take it in the middle of the night if you wake up, unless your prescriber specifically instructs otherwise. Do not take extra tablets. Do not take it with alcohol. Do not drive after taking it. Do not take it before doing chores, cooking, answering emails, or having serious conversations. This is a bedtime medication, not a "let me take it and finish laundry" medication. Quviviq can be taken with or without food. However, taking it with a large or high-fat meal may delay how quickly it works. So if a patient takes Quviviq right after a heavy late dinner and says it did not work fast enough, the meal may be part of the story. A simple teaching line is, a heavy meal close to bedtime may delay the effect, so follow your provider's instructions about timing. The stomach said, "I am still working down here, please wait." Common side effects may include headache, sleepiness, fatigue, dizziness, nausea, next day drowsiness, slower reaction time, and abnormal dreams in some patients. Quviviq can impair alertness the next day. This can affect driving, operating machinery, decision-making, balance, reaction time, work performance, and fall risk. The risk can be higher if the dose is too high, the patient does not sleep enough hours, Quviviq is combined with alcohol, or combined with other sedating medications. Narcolepsy, contraindication. Quviviq should not be used in patients with narcolepsy. Why? Because orexin signaling is deeply involved in wakefulness, and narcolepsy is already a disorder of sleep-wake regulation. If a patient has narcolepsy or symptoms suggestive of narcolepsy, such as sudden sleep attacks or cataplexy, they should tell the provider. Simple teaching line. Do not use Quviviq if you have narcolepsy. Quviviq can cause central nervous system depression. Avoid or use extreme caution with alcohol, benzodiazepines, opioids, muscle relaxers, and other sedating medications. Sleep medications can sometimes be associated with complex sleep behaviors. These may include sleepwalking, sleep driving, preparing food while not fully awake. If a patient has complex sleep behaviors, they should contact the provider right away. If you wake up and the kitchen looks like a raccoon hosted a buffet, that is not just funny. That is a safety concern. Sleep-related symptoms can include sleep paralysis and hallucinations. This can be scary. These symptoms should be reported. Also, monitor for worsening depression or new suicidal thoughts. A sleep medication should not make mood safety worse. If someone is in immediate danger, call 988 for the Suicide and Crisis Lifeline. If mood changes appear, report them quickly. Providers should consider breathing-related sleep disorders like sleep apnea. Quviviq is processed through the liver. Moderate liver impairment may need a lower dose. Also check for CYP3A4 interactions. Strong inhibitors may increase levels and side effects. The medication list is not paperwork, it is the map. Finally, consider pregnancy and breastfeeding. Sleep problems in pregnancy are complicated. Medication decisions require a risk-benefit discussion. Quviviq can help sleep, but it should not be the only plan. Good sleep treatment also includes sleep hygiene and behavioral strategies. Medication can open the door to better sleep, but habits help keep the door open. If the patient drinks energy drinks at 6 p.m., scrolls TikTok in bed, naps from 5 to 7 p.m., and then wonders why sleep is missing, Quviviq may not be enough. Sleep routines matter. Let's bring it all together. Number 1. Quviviq is daridorexant. Number 2. It is a dual orexin receptor antagonist. Number 3. It is not a benzodiazepine or Z drug. Number 4. A common dose is 25 to 50 milligrams. Number 5. Take it within 30 minutes of bedtime. Safe sleep is the goal. Thank you for watching. Again, my name is Dr. Ben Osevwe, DNP-PMHNP. For support, you can text 83299 Please subscribe to our YouTube channel for more educational videos and join our mentorship family today at academy.rotationmatchnetwork.com. Quviviq is a tool, and when used carefully, it can be very helpful for adults with insomnia. See you in the next lesson.